Welcome to Dateline Health. This is Fred Lippman coming to you from Nova Southeastern University. I'm still using my mask when I'm not in a venue where I feel safe, so that's up to you. It's your choice, but I would suggest a mask, and I'm not going to get into the other issues of inoculation and of, whether you're going to get the vaccine or not, but talk to your doctors, let them give you some advice. Anyway, today we have a wonderful show. It's a very tough issue, but it relates to hospice care and Alzheimer's eligibility, and the corporate entity, which is one of the founding hospice entities for care in the state of Florida, is called VITAS Healthcare, or VITAS in general. And let me introduce to you Dr. Ileana Leyva, who is the Regional Medical Director for VITAS Healthcare. Welcome, Doctor.
Thank you so much. Thank you for giving us the opportunity to discuss this.
Well, let's let the people know what your responsibilities are, not you personally, but the corporate entity's responsibilities, because a lot of people know of hospice for end-of-life palliative care, but there's a lot more involved, so it's all yours.
Thank you so much. Yes, hospice is a Medicare benefit that, as many people understand, was initiated in the 80s. And the idea behind the hospice Medicare benefit was to be able to afford specialized care to individuals who were diagnosed with a terminal disease of prognostication 6 months or less, who were going to focus on symptom management, quality of life, understanding that the underlying nature of the illness itself was not reversible. And it really is predicated on what we look at as whole person care. It's not the person with the disease, it's the person within the context of their family, within the context of their community, and who they are as a human being who is experiencing this disease within that family unit. And so it really is very, very dependent on what we all the time speak to around interdisciplinary care, so that there are physicians, nurses, social worker, chaplains, and a multitude of other disciplines involved based on the individual needs of the patient. And the goal really is to say, yes, you may have a disease that has a terminal nature to it, but how do we make you live as best as possible for as long as possible, as naturally as possible, and optimize the time you do have with your family and your friends? And I personally am very proud. I've had hospice impact my life personally with family members, and it's truly great medical care. Sadly, I think it's underutilized for many, many patients, and often very, very late in the trajectory of an illness, so that they aren't able to garner and optimize the best out of the hospice benefit.
Well, we're gonna try to expand a bit about that, but let me introduce one of your colleagues, Maryann Watson, who is a nurse professional, and she's got a lot of acronyms by her name. So Maryann Watson is a clinical education and performance improvement, and she's VITAS as veterans advocate. So Maryann, welcome.
Thank you so much. It's really an honor to be here.
Well, tell us what your directive importance is, and what you actually are involved in with your clinical education and performance improvement.
Absolutely. So the education and the performance improvement department are connected. They're one and the same. Performance improvement is the backbone of the business end, and also the importance in making sure that we protect our patients. We make sure that they maintain the standards of care. We make sure that we work within our guidelines. And education plays a huge role in that in regards to caring for the patients on a daily basis and making sure they receive exactly what they're supposed to as far as the Medicare benefit and also from the VITAS guidelines. We love to think of ourselves as above the standard. We work very hard and we strive very hard to maintain good quality of life with our patients. So education is not just with our staff. Although one of my roles is working weekly with new orientees and hires, and on a daily basis, we do education and continue education with our staff through quality improvement or through our PI department, and make sure that everybody is comfortable and confident in the work that they do. One of our values is we are very proud of what we do. And in order to do that, our nurses and our healthcare professionals need to be constantly educated, re-educated, and reinforcing the importance of the work we do. And as you very well know, it is extremely important, the work that we do. I also educate out in the field, and I also teach all of our staff to be educators for family. Family needs the education on what we do on a regular basis. As Dr. Leyva said, we work very closely, not just with the patient, but the patient family as a whole. And in order to do a good job, we need them to feel confident in what we do. We need them to feel safe. And we need them to have the knowledge of what's happening so that they can be a part of the patient's life and part of the functionability of what's happening.
Before we get back to Dr. Leyva, let me also know that I know that you're VITAS's Veterans Advocate leader. Tell me what that is all about.
Well, just to tell you how I got there, I am a Navy brat. Both my parents were officers in World War II in the Navy. And I have a brother that served twice in Vietnam. So tag you're it. Our particular program in Broward has one of the largest populations of veterans on the hospice services at any given time. VITAS itself is very passionate about the care of our veterans. So one of my roles is to educate all staff in regards to the culture and the process of thinking of our veterans as they come on end of life. As I'm sure you know, veterans are very special people. They have a specific lifestyle that doesn't go away when they are discharged from their position. They live that lifestyle for the rest of their lives. We also know that a lot of things that may have happened to them while they were serving our country are things that they keep inside and have not shared with others. A lot of these things can cause a lot of anxiousness, a lot of anxiety. And we are very well aware that at end of life, a lot of times these people need to unload a lot of some of the anxieties and disparities that they've gone through. And we have a lot, I'm very proud to say, of social workers and chaplains that are veterans. So we have a lot of vet to vet conversations. And we have a lot of different programs that we, such as a bedside salute. We work to honor our veterans at end of life on every given occasion. I'm happy to say that we belong to the National Hospice and Palliative Care Organization's We Honor Vets program. And for the last 2 years, we've been at the highest level, level 5. And that means we're doing a good job. I hope that we do better this year and we maintain that level 5. But at the same time, it's a great honor to me personally to be able to honor our veterans on our program and to honor the patients' families.
Well, you know, the reason I brought it to your attention is that, firstly, we have a very strong movement here at Nova Southeastern University with a veterans program. We are matriculating well over 1,000, almost 2,000 veterans of recent, what they call conflicts. Some people call them wars, some people call them conflicts. Whatever it is, they're exposed to all kinds of problems. In fact, we have one of the world's experts on the exposure to certain elements that occurred during these conflicts, the burning of oil and things of that nature, that we're doing research not only for Nova Southeastern, but really for the United States and the world. So I'm very sensitive to what you just said. Dr. Leyva, let's get back to you because you know, the issue with that was just mentioned by Maryann Watson, we have a situation where many times we end up with a lot of, shall we, mental health problems. Directly, it's not always looked upon as a doctor's responsibility, but in essence, as you well know, whether you're a pediatrician, whether you're a geriatrician, whether you're a super subspecialist, or whether your specialty is general practice, you end up with a patient that has these mental health problems, and it's very common to see these mental health problems. And I'm just wondering about the intercession that you bring into your periods of time using the VITAS system and palliative healthcare programs to understand that some of these things have been going on for quite a while.
Correct. Yes, absolutely. And I think one of the things that I need to really highlight is that VITAS has a significant number of physicians that are specifically trained and board certified in hospice and palliative medicine. And as part of the training and board certification for this particular field of medicine, there is a great deal of emphasis and education and training regarding mental health. As you can well imagine, patients that are facing end of life, living through terminal disease, often develop or bring, as you say, with them all of their prior past medical history. So it is something we're very much assessing for. I think the other piece of it that is so helpful is that as the fact that we practice as an interdisciplinary team, we have the access to our licensed social workers and our chaplains that also have specific education and training to deal with this, in addition to as needed and based on the individual needs of every patient, we have the ability to bring in psychiatry, psychologists based on the individual needs of those patients. But I know that in my practice, I still see patients locally in one of our inpatient units. It is not infrequently that we are indeed managing concurrent comorbidities that are from the mental health piece. One comment about the veteran population that I know that has become more and more significant in the literature regarding end of life is that much of their PTSD, their post-traumatic stress disorder that has been well managed, really comes to the surface at end of life. And so there's a great deal of assessment and attention to that amongst myself and my colleagues when we're practicing our field of hospice and palliative medicine.
I'm glad to see that VITAS has placed into their construct as a corporate entity a veterans advocacy program. So my hat's off to you all. Maryann, let's get back to you for a second. Or more than a second. We'll give you a heck lot more than a second. Maryann, you have clinical education as part of your responsibility. Do you go out into communities, or do you just work with patients that come to you through various services like medical services and otherwise?
I do go out into the community. As a matter of fact, my role before COVID, and I call it BC, I was an education liaison out in the field quite a bit. I would be going to facilities. I went to community centers, and I would speak for many different types of groups, depending upon what the knowledge base was needed. A lot of what I spoke about would be end of life, but we also would include information about living wills and the importance of. We also did a huge amount of teaching, and I partnered with the memory disorder at Broward Hospital, and also with the Alzheimer's Association, with Alzheimer's, and more so the caregivers than the patients themselves. My own passion, my mother was an Alzheimer's patient. I am the only daughter and a nurse, so tag, you are the caregiver. I learned way back in the late 80s, early 90s, before Alzheimer's was really in the forefront, that it is a difficult and long process of a lot of sleepless nights, a lot of anxiety. So the more knowledge that we can bring to caregivers, the more education that we can give to families about someone that's been diagnosed is really not only just a passion, but something that VITAS really looks at closely. We do have a large population of Alzheimer's and dementia patients on our services. We do teach our staff how to work with dementia patients and also how to support family members. But I love going out in the field. I love speaking at facilities. I'm delighted to go to memory centers now, and they bring in the caregivers as a family as a whole, and we've had support groups. One of my support groups that I'm going to get back to shortly is at a community center called the Pride Center down in Wilton Manors, because I have a support group down there for caregivers that are caring for their partners with Alzheimer's. So it is something that we're getting back into again now that the masks are safe and that the numbers are down. And I really can't wait to get back in the field and do more education.
The reason I bring it up is that, again, especially with Alzheimer's, the support and the knowledge of the caregivers is so important, because God bless the Alzheimer's patient, whatever blessing we could give them, but the people who have to deal with it on a daily basis at home or wherever they are is paramount to some help from people like yourself or organizations such as VITAS Veterans Advocacy Program. Because the people who are watching us, they wonder, what happens? Who's going to care for me to care for them? And I think you gave me the answer. Dr. Leyva, you brought up a point, and I don't think people know actually that people who are physicians have residency programs in palliative care. Do you want to touch on that for a minute?
Absolutely. Yes, actually, it's a fellowship in hospice and palliative medicine. One must have done a primary care baseline, whether that's family practice, internal medicine. Actually, in 2010, there were 10 co-sponsoring boards of other fields that came together, and through the A.P.M, which is the American Board of Internal Medicine, established the track for board certification for hospice and palliative medicine. And so in this country, there are about 480 positions for fellowship training in the field of hospice and palliative medicine. I work very closely with the fellows out of the University of Miami Hospice and Palliative Medicine Fellowship. They do rotations with us. We're part of the volunteer faculty. But yes, regardless of the numbers that are being trained, there's just not enough of us in the field to care for the in ever increasing need for palliative and for hospice care. So certainly many are really trying to promote primary palliative care education that all physicians and physician students should get. So we work with both NOVA students, University of Miami students, FIU students from the med schools to really layer in primary palliative care so that they can integrate it into whatever field they go into. Additionally, I'll say, just to make a comment on the prior discussion around caregivers for Alzheimer and dementia patients, you know, the data is really, really impactful because the sheer fact of being a caregiver for someone with dementia or Alzheimer's puts that caregiver upwards of 86 to 87% at risk for illness for themselves, right? So morbidity and mortality for the sheer fact of being a caregiver increases upwards of 86 and 87%. That alone highlights how much of a challenge, both physically, emotionally, and spiritually, it is to be the 24/7 backbone in caregiving for these patients. And so one of the things that I hold in great esteem about my field, and especially represented by VITAS, is that we know that. And in knowing that, we act upon it, right? So we have the support structure, not just for the patient, but for those caregivers that are day in and day out, hands-on responsible for those patients. And that is a lost population. I think many times we know about the patient, we know the disease process, we manage the disease, but really it's those caregivers that are the lost victims in all of this. Many times I work with students, and one of the things I make all my students read is Care of the Caregiver, because I think that it's very, very important to understand, for me as a physician, regardless of how great the plan of care is that I develop for my patient, if the caregivers can't support it or can't execute it, it's not going to be a success for the patient. So they really are a huge population of folks that need more support and more attention.
I have a very close relationship to the whole hospice issue because at one point in time I was in government, and the bill actually came through my committee to allow for residential hospice care, because at that point in time in the early 80s, the only hospice that we knew was going on in England. I'm very proud of the fact that both of you were here. I think that both you, Dr. Leyva, and nurse professional Maryann Watson, I want to thank you for what you do, because you're not only doing work, in quotes, but you're advocates. You're advocates for palliative care, which means the reduction of pain. It's the dignity to the patient. It's the dignity to the loved ones. And I really am very proud to have both of you on today. And I want to thank you again, like I said before, not only for your knowledge and the procedures which you obviously go through continued research and knowledge, but I underline advocacy, because you are the blessed ones. And I thank you both very, very much. I appreciate you both being here today. This program is obviously a program that comes about because of questions that come from the viewers. And we get a lot of comments relative to end-of-life care. And that's why I thought it was so important to have both of you here today. I thank you again. Folks, I remind you that especially after this vicious, heinous pandemic that we've had, that a lot of you have not had the opportunity or could even get the opportunity to see your physicians. But please, if something is wrong, make an appointment, see your physicians. Thank you both for being here today. My name is Fred Lippman. I come to you from Nova Southeastern University. If you have any questions or otherwise, there's a address in here, right here, and all you do is give us a call and we'll pass it on to the professionals. We're here from VITAS today, and I ask you to find us again next week. And my name is Fred Lippman. Until next time, see you.